What's up, everybody? Coach Daisha here, bringing you this week's hot topic. This is one that I have talked about briefly in prior videos, but the overall topic gets brought up a lot, and it has to do with other forms of impact, how we can kind of get around that, and especially what we can do for populations that might also be dealing with osteoarthritis, recent injuries or surgeries, etc. And that topic is walking. Why is walking a wonderful weight bearing exercise for everything but osteoporosis? So, I want to briefly talk about why walking is very important for your overall health, but why walking technically isn't going to help you build that bone mineral density that you're looking for if you have that diagnosis. So let's get started. So, first off, why is walking important? And I don't want you to think that I'm about to bash walking for the rest of this video, because I personally love walking and think it's the most important movement activity that we as humans can do. And it's got so many benefits. Walking, of course, is accessible to all of us, right? As long as our two legs are working, we have the ability to walk, whether it's inside of our homes, outside of our homes, on treadmills, on walking paths, whatever. We have accessibility when it comes to walking. Whereas it's harder to try to find ways to do other types of formats. We either need to go to the gym to do them, we need the equipment, et cetera, et cetera. Walking is also very, very beneficial for those who are either dealing with diabetes or heart disease. Walking has been proven time and time again to help improve insulin sensitivity and reduce cardiovascular disease. Walking also helps us maintain our ideal body weight. Of course, that's going to be different for everybody, but those people who walk more often, who get a lot more miles in each week, they have proper ratios of body fat to lean muscle, skeletal tissue, etc. So, walking, once again, so many benefits, and I'm not about to bash it. I love walking, but now let's talk about why walking by itself will not help you increase your bone mineral density. So there's two things that I want to touch on when it comes to walking and why walking by itself isn't going to help improve your BMD. The first is simple ground reaction force. When we walk, we are producing somewhere between 1 and maybe 1.2 times our body weight in ground reaction force. That's not enough to help build bone. You actually need something between 2 and 5 times your body weight in ground reaction force in order to see osteoblast activity in the bones. The second thing is foot strike. Now, most people, if we are walking correctly, we're going to strike with our heel, roll through our midfoot, and then push off of our toe. The angle at which our heel hits the ground does not create a vertical ground reaction force, which is what our body needs to build bone. When you contrast that with running, jogging, and other vertical type jumping movements, you now see that that ground reaction force can go straight up the lower leg into the hips and the pelvis, whereas walking, due to how our foot strikes the ground, can't really produce that. Now, there are a couple of studies out there that have studied what fast or brisk walking can do with bone mineral density. Now, a couple of things about these studies. First off, they were done on younger women, premenopausal. The other thing to keep in mind is that the rate at which the participants were walking in a lot of these studies is somewhere around 3.5 miles per hour, which is less than 20 minutes per mile. That's a pretty fast clip for certain people. Younger demographics might be able to get away with that. If you are not accustomed to walking on a regular basis, you probably don't walk that fast. Now, once again, those studies were done on a younger population, but they did find that there was a slight increase in bone mineral density at the femoral neck with this particular brisk walking protocol. So these people were walking, once again, somewhere between 3 and 5 miles per hour walking. They were doing this for upwards of 30 minutes at a time, and they were doing it for 3 times or more per week. So let me wrap this up in a nice, neat little bow for you. If you believe you can briskly walk. And you're going to do that for at least 30 minutes at a time, at least 3 times a week. And you're going to combine it with the other things that we know help, right? So that's your strength training, that's other impact movements, etc. Walking could help you improve your bone mineral density, but walking by itself is not going to do it. Am I telling you not to walk? Nope, absolutely not. I'm telling you, you should walk. Walking should be a part of your daily routine, not just weekly. Get out there and do an intentional walk every single day if you can. Because as I mentioned at the top of this video, walking has so many other benefits that you can utilize in your overall health that might not be osteoporosis specific, but you still need them in order to live that vibrant and healthy life that you're looking for. And that's it for this week's hot topic. I would actually love to know in the comments, do you know how fast you walk currently? Have you ever clocked it to see how many miles per hour you're currently walking? I know for me, I'm at around 3 now. I used to be a little bit higher than that, but over these past few years, especially, post bionic hip surgeries, I am not as fast as I used to be, but I'm still somewhere around 3 miles per hour. But I would love to know, do you know how fast you walk? And if you're somewhere in that 3 range and want to start adding brisk walking, are you going to do it? And see if it's going to help at all with your osteoporosis diagnosis. Once again, that's it for this week. I hope you enjoyed this hot topic, and I will see you next week.